What's the real measure of success when you're trying to reduce your weight, or should you even be reducing your weight, right? Well, look, here's a couple things I want to be clear about. Number one, BMI is a research tool and it's a screening tool. It is not meant to drive therapy. And so it was an easy way that you can do a quick screening of the population and to segment out the population and say, hey, you know what? At this cutoff of a BMI, there might be an increased risk of diseases and you should look further into that population. And we generally use like 25. Could you be unhealthy with a BMI of 22? Yes, you could. But that's where we say, okay, let's go get some lab work and do further work. So a screening test is what BMI. So once you have a high BMI and you also have evidence of disease or we're concerned, then we don't necessarily have to normalize the BMI, right? You don't have to get people down to a BMI of 20 or 25, right? But we do use it as research to say we need to decrease weight. So what about measuring the belly? Okay, yes, there's another screening test that the World Health Organization has, and we could use that as a screening test. Now, I personally do use that for a therapeutic goal. I try to get most women down to at least a belly of 32. Guys, I try to get you down to 37, 38. Why? Because it also reflects your visceral fat. So a gold standard would be like doing a DEXA scan or MRI of the belly, and that would be a great diagnostic test to see, do you have too much visceral fat? But the waist and the BMI are screening tools. They are not meant for therapy. And I'm out of time, so maybe I'll make a longer video if you guys leave a comment and you want it. Tubby Doc out.